All right, so it's Monday. It is 7:30 p.m. It is Central Standard Time, and I am looking out the window from the office, and I see a gorgeous sunset on the way. I can't wait. So if I get distracted, I apologize. I'm just really excited. So what we're going to talk about today? Well, one thing I kind of wanted to address was, is there a difference between the traditional medical model as opposed to what the holistic model is? And quite honestly, what does it really actually mean? Is there like a definition to this? Or what is it when I'm talking about holistic? Does it even make sense to anybody? A lot of words are tossed around, and sometimes I think I've learned myself, and maybe I'm alone here, but sometimes I think I know what I'm talking about, or I think I know what someone's saying, but maybe I don't. And so I kind of wanted to clarify a little bit of things for you. Maybe that's the teacher in me. I don't know. So I apologize. Again, there's no test ever. I'm purely trying to just help you understand some different things. And based on the people that I end up seeing and the clients that choose to work with me, there sometimes is a little bit of a gap, and that's why I'm here. I think I've been called to help serve in a very unique way. And when I say serve, that's genuinely where I'm coming from. Those of you that have kind of done a little research and dig into my website, you understand that I am very faith-based. I am a Christian woman, and I am a firm believer that God has given us all bodies, and it is up to us to determine exactly what to do with that body, right? In order to kind of help live out the service and mission that we are here for. And so with my body, this is going to sound kind of funny, but I think part of my role in life was to go through some things and to experience some things. So it provides me an opportunity to perhaps be a little bit more relatable to other people. That could be one of the reasons that I've had 10 surgeries. That could be one of the reasons that I've gone through lots of different diagnoses and different things in the medical world, so I can actually have somewhat of an understanding of that. And again, just like I say with the information that I've shared with you, I really want to be a bridge. I really want to help people understand the medical as opposed to the holistic, and then how we can blend them together. So with that being said, I've got some definitions here. I'm going to read some of these for you, and part of it is just so I stay a little bit on task and can give you actually truly maybe a definition that'll make sense to you. So let's go right first to allopathic medicine, or the traditional medical model. I spent years in that. That's how I was trained as a nurse. So I worked side by side with other medical providers in an atmosphere in order to help provide allopathic medicine in order to help manage and serve the populations that I did. What does that mean? So allopathic medicine is conventional or orthodox, or what we would call Western medicine. It's a system of medical practice that emphasizes the use of evidence-based therapies to diagnose and treat disease, such as medications, right? You've got surgery, you've got radiation therapy, or diagnostic tests. So this is based on a principle that disease is caused by external factors, such as like bacteria, viruses, injuries, and can be treated by addressing such factors. So think about it. You end up in a car accident, you have some sort of trauma to your body, you need to have your bones put back together, perhaps a surgery in order to manage that. You might require some medications for pain, maybe an antibiotic in order to help you prevent an infection, and you may or may not need hospitalization. So all of that could be what we call allopathic medicine. Is there a place for that? Darn tootin' there is, and I want to make sure that someone has that knowledge base and can go ahead and help treat me if I get broken. Okay. Now, I want to throw in a different idea, something called holistic. Holistic health refers to an approach to well-being that considers the whole person, including their physical, okay, as well as their mental, emotional, and spiritual aspects. It emphasizes the interconnectedness, or how all of these factors aim to promote optimal health by addressing all of them. So holistic health practitioners, they believe that you treat the body, the mind, and the spirit in harmony to lead to an overall improved well-being. Maybe there's a lot of different practices that are incorporated. Sometimes you have lifestyle modifications, maybe diet, exercise, stress management, sleep hygiene. Maybe you have alternative therapies that get brought in, such as herbs, acupuncture, massage, yoga. Maybe there's mindfulness or meditation that you're working with. That's going to kind of help improve your mental and emotional health. Or spiritual practices. That could include prayer, perhaps journaling, spending time in nature. So holistic health, one thing I really want to really emphasize is that it is not a one size fits all. In fact, it's a one size only fits one person type of approach, where you tailor the recommendations to the individual specific needs and preferences. So you have to meet people where they're at. The goal is to empower the individual or the person that is being assisted to take responsibility of their own health and achieve a state of balance and wellness. So, you've heard me say that I'm a nurse that understands and appreciates what we would call the traditional Western medicine modality in order to kind of help manage and treat a disease when needed. But I also say that I'm a holistic health provider because I'm both, and that's what's really cool. I see both worlds. And so I look at it as an amazing ability to have a foot in one and the other. So is it something that I am against medical? Absolutely not. Like I've mentioned before, I really believe that there is a place. But I also look at it to say, how do you put all of it together? And so when I'm meeting with people and I'm really trying to understand where they're at, that's the idea of meeting them. So I have a variety of different clients. I have some that come in on multiple medications and they've had multiple different diagnoses. So how do I help them understand that there are ways that you can work with your body? Maybe there's different practices. I specialize in nutritional components of that. So I really look to the first thing that I mentioned when I just kind of gave you that definition, right? I'm looking at diet. Are there certain things that a person can utilize food as medicine for? Is there exercise components that they could try to work in? Perhaps there's stress management techniques. And how about sleep? I try to address a lot of those things as well as what's going on outside in the bigger world. What's happening with lifestyle management? Are we having a lot of toxins that we need to kind of look at in our environment? All of those things put together could very well be a component. But I do address other things. It's just that my knowledge base, I really like to share with those that are very good at it. So I could really tell you, you know what, I think yoga would be an amazing benefit, but I can guarantee you, you do not want me to lead you in a yoga practice. I am not a professional when it comes to that. In fact, I'd probably put you into some sort of a weird pretzel thing and you would never get out of it. I am not an acupuncturist. Okay, I can give you some very basic information on meditation, but I'd really love to key you up with somebody that's very good at that. When it comes to very basic mindfulness practices, you bet I can sure help you along those routes as well and give you kind of a very generalized guideline on that. And it could be something that might just be what you need. In spiritual practices, you bet I can pray with you. I can encourage you to pray. But if we need to get down to the nitty gritty and we've got more questions when it comes to the idea of prayer and maybe more advanced spiritual practices, I might want to actually refer you to other people. So I understand where my knowledge base is and how I've been able to kind of navigate, pull in that medical background, really truly understand and appreciate it, as well as help you understand and branch out and head towards a really cool way to understand where your ability to heal is actually from. So I'm kind of trying to help you grasp the idea of both worlds can totally exist together. But how do we really get the body doing the way that God intended it? How does the body start to heal? How does the body start to really navigate that on its own with you as the guider? How do you get in tune with understanding what's going on? Those are the fun things that I really like to help you understand and I help teach you. So I see that we have somebody watching and I am so excited. I want to give a shout out. How you doing? I see you. I can call you out by name, but I won't. I'm super excited that you're here. If you guys have any questions about anything, I encourage you to go ahead and ask. By all means. Oh, I got another person. How exciting. I get excited. I'm trying to understand and navigate this little Facebook thing so I can kind of see that there's two little eyeballs up there. So I think that's super fun. But any questions that you have, I would love to start addressing the things that you really want to know. Again, I tend to have kind of a knowledge base on a lot of stuff. And for those of you that have met me or know me personally, you understand that I'm kind of a geek when it comes to things, and I get a little fixated. And so you get me running down a rabbit hole, you're going to have me talking forever on it. And I want to always be very mindful of your time and what you're really looking for. So it's kind of fun to just kind of dive on into some of the really cool topics. So I am fascinated by the idea that food is medicine, and what foods can you use to help you really start to nourish your body and get you going. That's one of the things I'm just fascinated with. Another thing is like utilizing some of the things you see behind me, these little funky little bottles here. So this is like whole food and herbal nutrition. And so what it does is it helps get into your body to give your body perhaps maybe some of the nutrients that you might be missing. And that's where the muscle testing comes in. And so one of the things that I do in practice, I've got a couple of different things. So for sure, one of them is looking at what's going on in the body, utilizing natural reflexes. It's a non-invasive way that is able to assess stress. And I can kind of develop and kind of get into the root on what's going on. And then I match that up to whatever specific supplementation works. So, for example, perhaps maybe you are having an issue with digestion, and maybe you just don't have the right enzymes in order to help digest your food. Well, if you can't digest your food, then your body's not going to be able to absorb the nutrition that you need. So if we get you the right type of an enzyme, maybe we can get the body headed in the right direction. Maybe you've come in contact with some pretty nasty chemicals in your lifetime. I know I sure have, not only at work, but some of the things I've injected into my body, quite honestly, with a lot of the medications. And so helping my body clean that up and helping support my liver so it can detox, that requires maybe a little help. I don't know about you guys, but I'm really not into eating a lot of liver. I actually would rather take it in a pill. And so with that, how do we help support the body so the body can detox appropriately, help get some of those chemicals out of places so it actually functions the way it needs to? Those are just two very simple examples of all the really fun things that you do. And so the idea that I have that medical background that understands, oh yeah, we've got this thing going on. This is a diagnosis based on certain symptoms. Okay, those symptoms are great, but the bigger question that I have is the why. So let's use an example. People that I meet. So a lot of women, I tend to manage and help a lot of women. They'll come to me saying that, I think my hormones are off. Now, I have a couple of different ways that I can work with hormones. Hormone number one is, okay, I can run functional labs. I have the ability to order a lab panel, and we could, in theory, look and see what the hormones are. That could be one potential option. However, I actually prefer the idea of maybe we look at functional labs if you're interested, and we can kind of determine, are there other things going on? Because I like to be like a little 5-year-old. I don't know if you guys, remember 5-year-olds, if you're mommies, you understand that they don't ever stop asking the why question. And that tends to be where I like to go, especially when I'm meeting a new person. You come in, you have a list of diagnoses. So we'll go back to the hormone thing. Maybe, for example, you're having some cycle irregularity. You're having a lot of clotting, maybe a lot of really heavy cycles. Your cycles might not be on a normal 28-day pattern. And you're sitting here going, okay, I know something's off. And so maybe you go into your medical doctor. Your medical doctor says, absolutely, you're having a problem. So we're going to put you on some sort of birth control because that'll suppress your symptoms for you. And that'll allow your body to actually just kind of regulate the hormones, for example. Okay, that's one option. Another option could be, all right, what's going on in your body that's actually causing your hormones to be off? Could there be something happening in your body that you're not getting the correct nutrition? Maybe you don't have the right nutrients going into your body that's actually kind of playing into the idea that you have some sort of an autoimmune issue that's going and attacking a certain gland in your body, and then that gland's actually kind of feeding off of a different gland, and then everything's out of whack. The hormones are all off, all over the place. And all we need to do is actually correct one other component of it, perhaps maybe give you the right ability to digest, and then things will fall into place. Sounds a little kind of different. It's a different way to analyze it. It's a different way to look at it. But it's really going to what's the root cause of the issue, not just give you something to cover it up. So I can dive into different topics along those lines for you. I just kind of poke that one out because that seems to be a really big one. A lot of women, especially those that are in my age. Remember, I'm about 50. So we're all kind of in this spot where it's like something up, is something not up? So I encourage you, by all means, if you ever have any questions, you can reach out to me directly. You can find me on the website. Go ahead and just plop comments in there. I've got a phone number that's listed on there. That's actually a cell phone. You can shoot me a text. That's super easy as well. Ask me questions on Facebook. Ask me questions on whatever. I would love to be able to address whatever topics you want to know about. And I would like to try to do that in, again, like I said, a timely manner, because I could go off for hours. I love it. I'm passionate about this, and I just find just an amazing joy in helping people really start to see some major changes. And for some people, it literally could just be a lifestyle shift. Just the ability for their body to actually get food in, digest it, and get their body doing what it needs to. And then amazingly, their symptoms start to subside. So I think that's it for now. That sunset is starting to look absolutely gorgeous outside. So if you guys haven't been outside yet today, get your booties out there and just check it out. Otherwise, I will plan on seeing you guys next week. Thank you for watching, those of you that are live. I'm super excited to see you here. And next week, we'll come up with another topic if you guys don't have one for me first. Okay, I'll let you know. Talk to you later, and thanks for watching. See ya. Bye-bye.